to an outbreak of infectious disease of most types. Is to try to get the people infected away from the rest of the population. Isolation is another step in that process. Again, it's a standard practice in infectious disease. It separates people from others. It does allow delivery of specialized care to infectious persons. So you're isolated, but it do allow people to come in and provide services to you. When you're quarantined, that's completely different. You're kind of cut off. Let's get casualties. And this is my last slide for right now. I need a little bit of information about how to get in touch with us at the Institute for Faith Health Leadership. And so I know I've been talking to you for a while. I'm going to give you a minute or two to kind of, if you need to go to the bathroom or get up and stretch for a minute. Then I want to get into our first question. So how are we all doing? Everybody hanging in? Okay, good. We should have some food coming along pretty soon. And we are improving that website constantly. We're hoping to have some of the information, the databases that we're creating on there. We're hoping to have a portal soon so that if you have a request for technical assistance, you can actually just go out to the website and say, we want to request to have someone come and talk to our church about X, or we want, if you have any information about this particular thing, this is going on in our community, we need some information on. It could be H1N1, it could be any other type of health-related issue that you want to have addressed, either via just having information sent to you or even having someone come up to maybe even do a presentation. We hope to be able to have a way for you to ask for that type of technical assistance, because you generating the need will help us to be able to show that we need to provide this service and we can get the funding to do it.
So what other areas do you go to? Here in Philadelphia, do you go around the country?
We are currently funded to do Philadelphia, New Orleans, New York City, and Atlanta are the 4 sites that have been funded so far. We're hoping, because we've had requests from as far out as California, to be able to move it further west and to do more sessions to get more information and get more interaction with our community. And I'm hoping that might be able to happen, especially since it has been the issue has gotten so much bigger. When we started this, we were dealing with pandemic influenza. H1N1 hadn't even hit. And it just kind of all came together. The other really great thing that's happening now with the Institute for Faith Health Leadership, we are in partnership with the Tuskegee Institute Center for Bioethics. And Dr. Warren is serving as their director as well. And so we're going to be doing some work with that center and hoping to bring some of those resources to help us do some of this work as well. So we are dealing with issues from everything like environmental justice concerns, which is one of my areas of expertise. I do civil rights law, and my master's background is in environmental occupational health. And so we're going to be hoping to provide technical assistance in a number of different health areas. And we also have a toxicologist on board. We have a wide range of skill sets that we're hoping to try to help bring to our communities.
The partnership with Tuskegee should be quite beneficial.
Yeah.
You have a lot of, particularly in this relationship with their history,
right,
as far as ethics in research.
Right, because we really have to help our people to re-engage the system in a meaningful way, because we can't consistently point our fingers and say you don't include us when if we're asked to participate and we refuse. And we have a little bit of baggage we need to deal with in regards to trust.
Yep.
And we have some things and we need to deal with them ourselves, among ourselves, and figure out how do we start to re-engage, because we can't keep opting out of, opportunities for clinical trials, and because then the medicines and the recommendations don't include us. So
I do a lot of talks on that subject. Inclusion of minority populations. Clinical research projects. I do research, and every time I look at numbers, it's like we're not there.
We're not there, and many times, it used to be because we weren't invited, but that's not always the case. We have a huge issue around trust when it comes to biomedical research. We have even not just in biomedical research, but even just receiving, programs. It's just, the history has not been great.
You just go to the doctor.
Yeah, exactly. Engaging the healthcare system at all. A lot of it is about trust, and how do you deal with that in a way that will get people to get the services that they need, so that we're right. So we're not dying the most of illness, like we are with breast cancer and many of them. We don't have the highest prevalence, but we die the most because when and how we engage the healthcare system. So we also, working to, get more people trained, more open, having more black physicians, more black researchers, more people that look like us to be in the system to provide service will help to increase the numbers. But again, it's about trust, even when you have a black doctor.
But, and then you get that black doctor at the table.
Right.
To make decisions and to engage in those conversations with the experts, because I found that we have lots of expertise in the black community, but in many instances they still are not at the tables that they belong.
Absolutely.
Decisions for various political and other reasons.
Right. And I think that's one of the wonderful things Dr. Warren's trying to do at Tuskegee is to have a meeting where you're actually bringing in clinicians that are on the front line serving in black communities to sit down with black researchers who are doing the research, and with some policy people in there to try to help them to give them the anecdotal information about what they hear from their black clients about why they don't want to do X and Y. Because when we have these small cells and we're looking at research, we are guessing why we're not participating. But I think some of those physicians on the front line, they're hearing their patients are telling them. But because they're busy about doing the work of providing the service, they don't necessarily publish in the literature so that information is widespread. So Dr. Warren is trying to address that issue at the Bioethics Center. So I'm very excited about what we'll be able to accomplish there.
How can we find out the outcome of those kinds of meetings?
We're going to have it available on this website. And again, if keep in touch with the Institute. We're actually going to be engaging in improving the transmission of information from the Institute of Faith Health Leadership as well as the Bioethics Center, as far as what's available on their website, and as well as I don't want to say it wrong, Jabari, it is the interactive, what am I trying to say? Bioethics Center. What they try to create but they don't really have yet.
This could be an interactive website.
Right, but what is it called? The virtual tour.
Oh yeah, there would be a virtual museum.
Yeah.
That's
And so you actually be able to go in and take a look at some of the things that happen in like a kind of real time like way. So hopefully that will